Preparing to live. Namaskar, everybody. We are back with our second session of COVID management, and we have Dr. Vimarsh Rana again. Namaskar, Vimarsh ji.
Namaste.
And Namaskar, Nirja ji, the co-host for today. So, as yesterday, Vimarsh, we are going to talk about COVID and the various scenarios around it. We'll wait for a few minutes for audience to join in. We've got a few people joined in on Zoom, and some people will be joining on Facebook. So, situation though abhi bhi it's not getting any better, and we are just hoping that things improve in the next few weeks. We keep getting messages, somebody is needing oxygen, somebody needs plasma, and we are really grateful to a very dynamic group of volunteers in India. Hum log to bahar se reh ke, we can only offer our support and share things and talk about various scenarios, but the people who are actually on the ground, who are actually passing things on to people, supplying oxygen, I think we are so grateful. They are holding the country together this time. So let's give it a few minutes. So Vimarshi, how is the COVID situation in US at the moment?
So it's much better as compared to before. I mean, we've had the first big wave, then there was a bigger second wave as well. Some places are having a third wave as well. I live in Wisconsin. Wisconsin relatively is doing good right now, but some of my neighboring states are going through again another third wave right now. And the only thing is that we are not seeing too many people getting sick right now because of the vaccination which has been done. I think the US vaccination rate is somewhere around, give or take, like 20%, but still that has helped. On the other hand, what we've noticed is that this wave usually is in the younger age groups, and actually that might be the vaccination reason as well, because the first phase vaccination went with vaccinating people who are elderly, the senior citizens over here. So I think that probably has helped to contain the third wave to a point where we are seeing lesser number of sicker patients getting admitted to the hospital. And I'm expecting hopefully the same thing to happen in India as well. As vaccination gets more prevalent, I think the severity of the cases which we'll see in the hospitals, that is going to go down.
Yes. Yes. So, but in India, I think it is just the beginning. So we talked about a lot of scenarios yesterday, and there are still some questions which have come since yesterday. So I'll start with one question. And so people are saying that a lot of the results, the PCR tests, they are coming negative, and but they have symptoms of COVID. So, should they repeat the test, or should they treat it as COVID? I think you did touch upon it, but could we talk about it a bit more today about negative PCR tests?
Sure. What I would say is that in a pandemic, the way we have the disease right now, and especially the way it is in India right now, we need to switch from a test-based strategy to a symptom-based treatment strategy. That is what has been done for ages, for many things. Like I think we briefly discussed yesterday, our books in India used to say that, if you have anybody in fever, treat it like malaria unless proven otherwise. I think it's the same thing which we have to do for COVID again, because right now this virus is new. It has many mutations as well. The way the testing is done is also not a simple blood test. There's a lot of variability in how the person takes the test as well, how the test is done as well. And there are a few other things as well. Let me go a little more into detail. So the first thing is that when someone gets infected with this virus, usually what we see is that the symptoms start on day 3 and day 4, but the test can come back positive on day 4, day 5, day 6 as well. So if you end up getting tested somewhere in between where you don't have sufficient number of viral colonies for that test to pick up, you probably will get a negative test. So that is why I don't think we should depend on the test too much. On the other hand, now there are
Yes.
different kinds of tests in the market as well. Now, different kinds of PCR tests as well. So all the PCR tests are not the same as well. I'll give you an example here, even in the US, when COVID started, when I was admitting patients to the hospital, a lot of them were negative. And,
Mm.
when we used to see that, no, this disease, the symptoms and everything which the patient has, we say that what walks like a duck, talks like a duck is a duck. So we said,
Mm.
no, this is COVID. We will treat this patient as COVID. And then we found out that the testing which we were doing initially was only sensitive up to there's a measure which we use, like maybe like 2,000 colonies per something. It was only sensitive up to that level.
Yes.
Now we have better tests where, even if you have like 150 or 250 colonies, the PCR still picks that up. Now, again, in India, there are different kinds of tests which are being used. So one test might not be sensitive enough as compared to the others. So that's the test variability as well. But on the other hand, there might be some strains which might not be picked up by a certain PCR test as compared to the others. So that variability has to be taken into consideration as well. And I know personally one person who has all the classical symptoms of COVID infection. Even the CT scan which was done shows very classical COVID infection. And the testing has been done like 3 times. All 3 tests have come back negative after, say, 48, 72 hours. So,
Yes.
so I'm sure there is some. I don't have any evidence on that right now because we are still learning about all this. But I'm sure there's some variability in testing. There are some maybe mutant variants which are not being picked up by some of the tests.
So one
Yes.
question I have in regard to this. So supposing somebody asked me on Facebook, how are you feeling? So yes, I have been having fever and chills. Thank you so much, Rajendra Razdanji, for asking. That's very nice of you. I had fever and chills since last Sunday. Supposing I had a test on probably Monday or Tuesday, how soon should I get a repeat test? If I'm tested negative in the first one, how soon should I get a repeat test? If it
Again,
persists.
it depends. It depends on where you are. Since you are in the US, what we say is that if you have to get tested, we usually say that after 72 hours you can get tested because most
Mm,
number of people who are in a window where the test is negative, usually
mm,
in 72 hours they can come back positive. So that's, thinking about how to use the resources well, plus what are the chances. There is a very, very small percentage which will still come back negative even after 72 hours as well. That is a possibility as well. But here in the US, we say that if there for some reason you have to be tested the second time to make sure that it is negative, you wait for 72 hours and then retest yourself. In India, I think you should not get retested. If it is a classical symptoms of COVID, if you have been tested, it is negative, your symptoms are consistent, you just treat it as a COVID infection. Uh, the reason I'm saying is that maybe you should not get retested is because there are a lot of people who might actually need that test at that moment of time. So to properly use resources, I think something like that, that kind of a triage strategy needs to be taken into consideration.
great,
So
thank you.
thank you very much. I had a follow-on question for that. Because here in Europe, we are not advised to take a second test, but to prove that you are negative, because the evidence is that you can still remain positive for a very long time, but not be infective. So the advice in the COVID season was that, okay, your first test is positive, you stay in isolation 14 days, and if you are symptom free, at least for 48 hours, which means, okay, then you can go about, you don't need another test to prove that you're negative, because sometimes the positive test can stay, because there's remnants. If the test is really sensitive, the remnants of the mRNA can stay, and the test will pick that up. So, but it doesn't mean
Exactly.
you are infective. So, but in India, I think people are waiting for a negative test. Do you have anything to say about that?
That's what exactly we are doing here in the US. We are not advising a retest for anyone. The only reason why we are doing a retest is patients who have to go into a setting, like a nursing home or some kind of a setting, because we absolutely don't want to miss even a single patient who has any active disease. And especially we have a lot of patients who end up in the hospital who are immunocompromised. So they can, in those patients, the disease can linger on for longer time, and the viral replication can continue for a longer time as well. So those selected are those groups where we are repeating the tests to make sure that the patient is negative before we send them into the nursing home. Otherwise, when we have a patient who gets admitted to the hospital, we use the same strategy. We actually do 10 days nowadays here in the US, although in India, I think we are still doing as well 2 weeks, which is reasonable because I think if you have a full-blown disease in an area, to catch more number of people, you can actually increase the number of days. Like I said yesterday, medicine has never been absolute. It is always dependent on what the patient is doing, what the community is doing. So I think that strategy of using like not retesting for 2 weeks and if in 48 hours the symptoms are gone, I think that is an appropriate strategy. And that again, that saves that test for someone who probably needs to be who needs to figure out whether he or she has a COVID infection or not.
Yes, and also it's important for the contacts because the contacts, they might be asymptomatic carriers, isn't it? So we are seeing, okay, the person has been asked to self-isolate, quarantine, the person who has tested positive, but the contacts who have tested, even tested negative, they are going around doing their normal business. But that's, I think, is not advisable because you can be an asymptomatic carrier. You might not have symptoms. So if you have been in contact with a COVID positive person, the advice is to stay. You also isolate yourself for 14 days. Is that good advice in India scenario as well?
Yes, in India's scenario, that is the good advice. That is what I think we should do. I'll just take an example where what we've done here in the US. In the US, when we were at the peak of the COVID infections, that is what we were doing as well. We told everybody who was in contact with COVID patients that they should isolate for 10 to 14 days, or if they have symptoms, if they are symptom free, after 48 hours they can sort of resume their work, but still isolate themselves for about 10 to 14 days. Now that COVID has come down here in the US, the guidelines have slightly changed. They say that, isolate yourself for a few days, or you can even go to work as long as you're not in a very close proximity with others. So it's sort of a variability here now because now that the number of cases have relatively gone down. But for India's scenario, I think anybody who's in contact with a COVID positive patient should isolate themselves, should quarantine themselves.
Yes, because the point is to break the chain of transmission. And I think that the problem we are having in India is there is widespread community transmission from asymptomatic carriers. That's a possibility. So this isolation, I think, is to break the chains so that the virus it replicates from person to person. So at the peak of COVID, one person here was infecting 3 other people. So the R rate was quite high. It was 1.52 at 3 at one point, which means that one person is in fact infecting 3 or 4 people. And then you can imagine how exponentially the numbers will rise if we keep following that. So so I think in India we are seeing that in this peak COVID season.
There's one more thing.
Yes.
One more thing I would like to add here that, and this is a frequent question which I'm being asked that, oh, my brother or sister had COVID and now we have isolated them. Can I go and get myself tested? Well, the question is that, if you just got exposed today or yesterday, even if you go and get tested and you're asymptomatic, you will probably come back negative. And then you'll have a false sense of security that you're negative and you'll probably go around doing your own business and might be an asymptomatic carrier. So again, getting a test is not an absolute thing that you do not have the virus, you will not spread the virus. It has to be taken into context with the exposure which you've been exposed to.
So how long do you think they should wait on till they get their test done? Like, is there a time period that they should think of and then get tested so that they get to know?
So if the person cannot isolate themselves, quarantine themselves, and wants to get tested and then go for their own work. So for example, healthcare workers, we don't want all the healthcare workers who've been exposed to sit at home because then who's going to run the hospitals? So in those cases, what we should do is that we should probably isolate them for say around 4 to 5 days, get them retested. If their test is negative and they don't have symptoms, then probably consider them someone who will not spread the disease. A very small fraction of even those patients might start to have some symptoms after say 5 to 7 days. So you sort of have to keep track of them as well while they are working. But for the most part, on a population metrics, I think this strategy might work well.
Sure. Uh, there was a question from yesterday. Actually, a lot of questions were answered by, I'm very thankful to Shafalika and Surendraji. They answered the questions on Facebook also, because
Okay.
some people had posted questions after the session. So there was one question that got missed, and I picked it from this morning. The question was, after the first vaccination, what are the chances of getting severely infected? Like if you get COVID, how bad it is. I mean, what kind of
Yeah.
security does your first vaccination give you?
Sure. I'll answer it like this. Even after the first vaccine, we know that the body is protected against the virus. We still don't know how much, but
Mm,
we know that, in 1 to 2 weeks, the body does form sufficient antibodies to give you some protection. Now,
mm,
anecdotally, I can tell you that I have not seen even a single person who had this first vaccine, got infected, and had the severe disease and ended up being on a ventilator or a BiPAP. I have not seen this. And that is what most of my friends also say. So I think it does give sufficient amount of protection to prevent a severe disease. But then again, we don't have any data. We don't have any study results so far to tell us that. Just to give you a little more context into this, so the 2 or 3 kinds of vaccines which we are using here in the US, Moderna and Pfizer, is a 2-dose vaccine. The Johnson and Johnson vaccine is a 1-dose vaccine. The Janssen vaccine has been stopped here in the US because they had some slight complications. That's a different story. But the fact that the Johnson and Johnson single dose vaccine study did show that even after one vaccine, people were protected, just tells me that this probably should work for all the other vaccines as well. So clearly, every vaccine gives you good amount of protection uh, against a severe disease. Again, vaccination does not prevent you from getting COVID infection. It does not prevent you from spreading the COVID infection. All it does is that makes sure uh, that you don't get a severe disease from it.
sure.
Yeah, because it just gets your body ready for the virus, and now the body knows that what the virus looks like, how to fight the virus. So as soon as the virus comes into your body, it is ready and knows how to tackle the virus.
Yes, actually, a lot of senior citizens are kind of apprehensive. That's what I'm saying, because my mom, initially was not keen on getting a vaccination because she heard about the side effects and then how I'm going to cope up with that and all that. So I insisted, no, you should get your vaccination done. So a lot of senior citizens like her are very apprehensive of getting this vaccination, which definitely is not true. Everyone should get vaccinated at some point of time, as and when it is
Yeah.
administered to them age wise and age group wise.
Yes.
Absolutely. I wanted to add something, Vimarsh, from my own experience. So, I'm an old age psychiatrist, so I work with elderly people. So when we had the first wave of COVID, how it swept through the older adult population, through care homes, and we had care homes where the 100% of the population had COVID, and there was a lot of mortality. Now then, the vaccination drive in UK, it started with the elderly, so the priority was given to people with who have possibly got dementia or who are above 75. So they were the first cohort of people who got the vaccine, and that was the Pfizer, and then following that, the AstraZeneca one. And I'm happy to report that, I'm still doing the same job. There are, fingers crossed, very few people who have come back with severe COVID. That some of them have turned COVID positive, but they've had a very mild illness as compared to the first wave. So people, especially those who have had both the doses, because the vaccination started in December. So the healthcare workers were the priority, and then the older adult population were at the same time. So both the groups of population and healthcare workers, like doctors and all, a lot of my colleagues, they did get COVID, even after 2 doses, but the severity was very less. So they just probably had a mild fever, just a bit of cough, as compared to the first wave. How devastating it was for the healthcare workers. We had in UK a lot of doctors sadly passed away, nurses, in hundreds. So vaccination has a big role. But in India, there are a lot of rumors spread as well. So I heard a rumor yesterday, and I would like to share here from one of my friends. They said, well, India, everybody's saying, oh, ever since we have had the vaccine, because first wave they didn't have, there wasn't much COVID, and now we've had the vaccine, and suddenly things have just got deteriorated significantly. Do you think the vaccine has to do something with it? Do you think the vaccine has caused the mutation? So that is a kind of rumor circulating, which obviously is not true. But do you want to say something about this? Because that can never happen, isn't it? It's not.
That can never happen. I mean, uh, the kind of vaccines which are there in India are basically antigen-based vaccines. Basically, what it is a small amount of protein which goes into your body. It's something similar to like so many other vaccines which we have taken since childhood in India. There's no possibility, and I want to stress on this, there's no possibility that any of these vaccines can cause the disease or can trigger the disease. In fact, what is interesting is that at least one or two studies which I know of, they have actually said that even patients who've had the COVID infection, when they have some post-COVID symptoms, if they get the vaccine, their post-COVID symptoms actually improve. So we can dig deeper into what post-COVID is, but honestly, the vaccine has so many good things that some people who will have a side effect will be very rare. When I say side effects, I mean like serious side effects will be very rare. Many people will have something or the other because of the vaccine, because the vaccine is triggering your body a similar kind of response which the virus is going to do. So you can have almost all the symptoms which the COVID infection does, but that is how our immune system works. That is how our immune system is trying to get ready to fight the virus in case the body sees the virus in future. So again, the vaccine will not cause the viral illness. It cannot initiate a viral illness. As far as I know, it cannot even trigger a viral illness. Like, even if somebody has a COVID infection and gets the virus, we don't think that it triggers a more severe response as compared to the general population. In fact, might have actually seen the other way around. In the studies which were done with Moderna and Pfizer, I think it was actually the other way around which were seen. Those patients who caught COVID or were found to be COVID positive after getting the first dose or the second dose of shot, their outcomes were much better as compared to general population.
Absolutely, and there is a lot of evidence now coming up. So I think in India, Covishield is the equivalent of AstraZeneca one. So there's a lot of evidence coming of its effectiveness. Around 80 to 90% after the second dose. So yes,
Can I say something on
yes.
that effectiveness? And I think we briefly touched on it yesterday as well. The way they say effectiveness for these vaccines is basically what kind of antibody response are they generating? So when they did the studies, they had kept some cutoffs, which they said was an appropriate antibody response. And every patient who made antibodies more than that was 1+ for the vaccine. Everybody who made a response less than that was considered as not a good responder. And that is how this 80, 90, 95% efficacy of the virus is there. But we don't really care about the antibody response. What we really care about is the patient going to get sick enough to land in the hospital, or will the patient die ultimately? That we know is almost zero. Patients who've had the vaccine, it is almost 0% of the patients who are going to die after the vaccine. It is almost 0% of the patients who are going to get severely sick after the vaccine. That is, I can safely say that. In fact, there was one data I was seeing that I think 0.04% of the patients, I don't know if it said was landed in the hospital or had severe disease, or even had COVID, I think, after the vaccine. I might be quoting it wrong, but I was reading some data about the Indian vaccines as well.
Yes, I mean, there is data from the vaccine companies, but then there's data from the patients. You and I, we see every day, and we can see the effectiveness of the vaccine. Now, some people are asking questions about the duration. So that's different for different vaccines. So I'm not too sure about do you have any idea of the duration and how that works between the first and the second dose?
So again, I don't know much about the Indian vaccines, but I think the second dose might be after the month's time. Th this is based on what the studies have been done. As a matter of fact, the way they have done the studies is like even in the studies, what they have seen is that the first dose response usually lasts for 4 to 5 months. That is why that 1 month, approximately 1 month time was chosen because some patients do have a shortened response time as well. So to sort of capture almost all the population or most of the population, they have kept the second dose at around 1 month. The same thing is with Moderna and Pfizer as well, like 21, 28 days. It's exactly the same kind of mechanism, same kind of, I would say, logic for the
Yes,
second dose. And
yes.
after the second dose, sufficient response is generated in, say, about 2 weeks' time. And after the second dose, 2 weeks' time, we consider that patient to be fully vaccinated or
I
Yes.
have a,
sufficiently immune.
I have a question with regard to that. Now, like in India, my mom, she got her first vaccine and then it was scheduled, the second one was scheduled after a month, but it was delayed. Now she's going to take it after 2 months. So the validity, as you said, is 4 or 5 months you're covered. The first vaccine is going to be good enough for that part. Now, my second follow-up question is, what happens when if you have a second dose after 1 month or 2 months, and in between somebody gets COVID or infected, or somebody in your house gets infected, and you're not able to go for that second dose? So, is there anything that any protocol, anything that they should follow in order to kind of stay safe at the same time, be available to their family?
Yeah, it's the same kind of recommendations right now because we don't know many details. We don't have sufficient data on people who have had the vaccine and then got infected. But we are using the same protocols. The person who got the COVID infection, isolate, quarantine that person for about 10 days. In India, we are doing 14 days, and rest of the family members should follow the same thing. Again, the same thing should be followed, like social distancing, cleaning of things where the patient has touched, all those things need to be followed. There's no difference in people who have been vaccinated and now catch COVID infection. But
Yeah, I do have
we
a
know,
family that got infected right after their first
oh,
dose, and
okay.
they're still dealing with it. And thankfully, they're not severely sick, but they do have all these symptoms. And of course, the worry is now when we go for the second dose, will we be okay to get that second
Yes,
vaccine?
yes, the second vaccine dose should be okay. And usually we say that, if you have, so for example, if somebody has had the first vaccine, now gets the COVID infection, say now is scheduled for the next dose, we say that maybe take the next dose 2 weeks after your symptoms have resolved, just to
Yeah,
let your body get over that sickness, that illness phase. But we do highly encourage people to get vaccinated after the COVID infection because we know that on one side, the post-COVID syndrome symptoms go down. On the other side, the patient's protection improves as well. Just to touch on one more thing that, the COVID virus also produces the response in the body. It is almost like getting vaccinated. But what we think is that the COVID virus antibody response in the body is much less as compared to what the vaccine does. We don't have concrete data on that right now. Like it is not, we don't know too much about it, but that is what we think it is. So that is why we encourage everybody to get all the 2 shots and get fully vaccinated.
Yes, and
sure.
that's the evidence we have in Europe as well. So we give it 28 days. So if you got COVID, give 28 days, and then you can have the vaccine after that. So thank you very much. We've changed tack a bit. There's a question on Facebook about the use of masks. So how effective are masks in preventing COVID? To your family members, and it's a very difficult topic. I can because there's not enough evidence, and there is some evidence, but not enough. But we can still, from empirical evidence, just talk about this mask situation.
Yeah. See, let me start with like this. Do we have any evidence that taking Tylenol changes things, changes outcomes in, say, many of the diseases. We don't. But we still use, when I say Tylenol, I mean paracetamol, crocin, acetaminophen. But we still use it because we know that it helps the patient symptomatically. It gets the fever down. Now, having a very high grade fever can cause its own side effects. So that is why we use this. In medicine, most of the things are and should be evidence based, but some of the things are just purely logic. We know that this disease is mainly spread by droplets. The way the droplets work is, for example, while I am talking right now, there are tiny droplets coming out of my mouth, which are going into the air. If I have a mask on and I have this mask in front of me, if I have this mask on, the chances of those droplets coming out are much less as compared to if I don't have a mask on. So it's just pure logic that, it is going to help and we should use the masks on. Now, on the other hand, and the same thing is with the nose as well. We breathe through our nose as well. So there are some droplets which are coming out of the nose as well. So that is why it's very important that when we wear a mask, we cover our nose and our mouth as well. Now, it also depends on what kind of mask are you using. If you're using a surgical mask like this, you need to wear it, pinch your nose, make sure that you have the least amount of areas from which any droplets can come out. So that is you need to know how to use the mask properly so that you can cover all the open areas. A surgical mask still has loose areas around it. Plus, the surgical area, the mesh which is in front of the mask has much bigger holes as well, as compared to many other masks like N95. So an N95 is a much higher, much better protection as compared to a surgical mask. So yes, masks help. It also depends on what kind of mask you are using as well. So that is what I would say. Is there a study which has shown that? I know that there's no concrete study, but can we say that we healthcare providers, when we work in the hospital, all of us basically use PPE, the N95s and other things, because we know that it's just logical.
Absolutely. No, I didn't mean there was no evidence in masks. I was saying between different masks, and you have touched that point. Surgical masks, safest, cheapest to use. But then as we go into healthcare, seeing patients, then obviously we have to wear the full PPE and the N95. But even at home, there, you can, if you have COVID, you can use some PPE to protect your relatives and children and everybody else from getting it. I mean, would you, for instance, recommend the use of maybe gloves or aprons, things like that, PPE at home while going, because people, sometimes you live in flats and apartments, and there is no option but to share the kitchen or share the toilets. So what kind of measures should people who are COVID positive take to prevent it infecting their loved ones at home?
So that's a wonderful point. I mean, if you live in a place where, say, there's a common kitchen where more than one person has to use the same kitchen, then you can have, say, a personal protective equipment kind of a thing. You can use a gown or something which you just use when you go in that kitchen, and then you take it off, either wash it after every use, or maybe just keep that one gown for one day when you go into that kitchen and you use it. All that will do is that it will sort of isolate those people who are going into the room. So that is a good way of doing that as well. Again, the same thing. If there's a common kitchen which you are using, many people live in a common apartment kind of a place where the kitchen is shared by different families as well. So I would encourage that yes, they should wear a mask in the common area where everybody is sitting. They should wash their hands frequently. They can use gloves as well, but hand washing is equally good, or I would say even better as compared to using a glove, because the gloves are mostly of a material which are either like latex, plastic, things like that. They have a higher affinity for viruses, and we know that viruses actually can live longer on these objects as compared to many other things, or even our hand. So I would encourage that yes, use personal protective equipment. You can use gloves, but the most important thing is basically hand washing and using the mask.
Yes.
Yeah, I
And
think
with
that.
gloves, obviously, everything has to be disposable. You can't reuse, just one off use, and then you have to discard it.
Yes.
So that is good. And also about washing clothes and all, because a lot of my relatives were asking about, should obviously the clothes should be washed separately, in a separate washing machine at high temperatures. Yeah,
At high
that
temperatures.
that's what will kill the virus. No, thank you for that. We have
And
another
I think
question.
one point here. I think isolation of the patient is a must. You cannot share that area, whether they are in a room, or you have to stay away from that for the family who is healthy and they are maintaining all kinds of precautions and everything. I think they should still be away from the patient, whether or not they are wearing masks, whether or not they are following all protocols. The patient should be isolated at every point of time till
Yes, I
they.
agree. That patient should be quarantined in a room separately. But sometimes a very strict quarantine on isolation is not practical because
Yeah,
that person might be too sick, might need help, might even
yeah,
need help to get up and go to the bathroom. So I think
yeah.
in those cases, yes, you can use personal protective equipment. You should use a mask. You should wash your hands. You should probably even shower after taking care of the patient. Might be a good thing to do as well.
Absolutely. There's one more question. It's not regarding this though, but it's asking about would you recommend traditional decoctions like naturopathy? Uh, has it proven helpful? Do you have any thing to share about that?
Again, there's no data about it if it helps or not, but there are some things where people can feel comfortable about. Give you my own example. When COVID started, I wanted to make sure that my vitamin C levels are not low, so I put oranges in my daily diet. So I think people do see a lot of information. They do have a lot of beliefs. They can follow those beliefs as long as they are not harmful. And most of the concoctions which we've seen are not harmful. So I don't think there's a problem in continuing that. But don't think that that can replace any kind of treatment which we have. Don't think that that will replace vaccine. Don't think that can replace oxygen. Don't think that can replace any of the medications which we have. I have heard about people using camphor. It will not replace the need of oxygen. I've heard, like we discussed yesterday about alcohol, that is not going to be effective in preventing COVID spread. Uh, so do whatever you feel comfortable with. That is part of our belief. That is the part of our Indian belief system. I would not discourage you to do that, but don't think that that will prevent that will replace the current medications or the current things which we are doing.
Yes. So especially once the virus has actually entered the body, you can do these immunity booster things, I think, before you get it. But once the virus has actually entered your body, it is only the evidence-based treatment which is going to work, things like oxygen and steroids. And so coming to the steroid question, there was a question yesterday actually about steroids. Now, there is very conflicting evidence about the use of steroids. It is a very cheap drug to take, I think it's 5 rupees or something in India. Here also in West, it's very cheap. So it's quick and easy, but does it work? That's the question. And at what time in the trajectory of the illness should you take dexamethasone? Because it will be effective because we get the virus, the immune storm, which you can talk about. We'll talk about that in a minute. And that's not on the first day of the illness. That can come on the fifth or the sixth day of the
Yeah.
illness, and that's the time to take the steroids. So, Dr. Rana, do you want to talk about the use of steroids in COVID?
So let me start with how we think about medicine and diseases in India. Everywhere we think that somebody gets an infection, a bacterial infection, we use an antibiotic, that antibiotic kills the bacteria and the disease goes away. That is the traditional way our mind thinks about a disease. COVID is different. What happens is, and in fact, most of the viral illnesses are different. What happens is that the virus goes into our body, it replicates in our body, it triggers the immune system after, which happens in a few days, say after 4 or 5 days that happens. And let me give you a vague timeline as well. So if on day one, the COVID virus goes into our body, it enters all the cells, including the lung cells, heart cells, everywhere in our body. It replicates over there. It the body's immune system sees that something bad is going on and it gets triggered. And that happens on day 4, day 5. And it's actually not the virus which actually causes the direct damage. It is our body's immune system which ramps up so much and starts to kill all the cells around there. And that is called as a cytokine storm. If we use steroids on day 1, 2, 3, where the virus is replicating in the body, we might actually harm ourselves. Now, again, I don't have any data for that, but that is what we think. We might actually harm ourselves if we take the steroids because we are preventing our body to, to fight that virus. Steroids, they affect our immune system, they suppress our immunity. We might actually harm ourselves by taking steroids on the day 1, 2, 3, that phase. However, if the body has sufficient damage because of the cytokine storm, that means that the immune system is over ramped up and now is creating a problem for our own body. And what we see at that time is usually the lungs are affected the most. The oxygen saturation drops to around 94 or less than that. That is where the evidence is where we should use steroids. So it's the steroids does not do anything to the virus directly. It basically calms our immune system down, which is actually causing the damage. So that is where the evidence is. That is where we should use the steroids. So please don't use steroids if you are positive for COVID-19 because you might actually harm yourself rather than benefit yourself. Be in touch with your doctors. Uh, have a pulse oximeter at home. If your oxygen saturation is going below 95, say somewhere around 94, 93, and there are different numbers which different doctors are using, which is okay. Anything between 92 to 94 to start a steroid should be okay. But that is where we can start steroids. There is very good evidence for it. We know that it saves lives, and yes, it is very good at that time. It prevents people from dying.
Absolutely, so like you said, it's an immunosuppressant. So if you take it earlier, you might aggravate the illness because there's always because when you panic, you get COVID, and you tend to especially lay people who are not medics, they tend to throw everything at themselves. Steroids, this, that,
Yeah.
remdesivir, all the kind of fabulous.
And I can say a little more on this. So again, like we discussed yesterday, the O2 sats should not be taken as an absolute number. A patient who has COPD, whose baseline oxygen saturation is 91, might not be in a cytokine storm. So it has to be taken in context with that person as well. On the other hand, that is why we do a lot of other inflammatory markers, the D dimers, CRP, ferritin levels. So when we admit patients in the hospital or even as an outpatient, we try to trend those markers. If we are seeing those markers are going up, that just gives us an indication that the cytokine storm is getting worse. And in those patients, we use steroids. So we do sometimes very rarely use steroids in patients whose O2 sats are even above 95% as well. But we have some indication that a cytokine storm is going on. To suppress that cytokine storm, we use steroids at that time.
Absolutely. And the cytokine storm is the basis of devastation of the lungs, which you see on CT, it's all hazy, all the lungs. And one of the reasons for that is not actually the virus, it's the cytokine storm that follows the infection. So that's a very good
Exactly.
about using the steroids, just because it's readily available and cheap. So don't take it without any medical advice. Yeah. So
Yeah.
so that is good. So Nirjaji, there was more questions from Facebook.
No, I don't think so. I think we pretty much answered all the questions, and I think Surendraji has been following up on Facebook also.
Yes, so we're
But
trying to close up on
we are
Facebook.
trying to help as much as we can.
So coming to the treatment, Dr. Anna, before we conclude today's episode, do you want to talk a bit about again about remdesivir? I can't even pronounce
Remdesivir, yeah.
tongue twister. So so there is a lot of emphasis on the use. There's actually a black market going on at the moment. I heard where one injection can cost 2 lakhs instead of 40,000 rupees, which is its actual cost. So again, like steroids, at what point is it effective, and is it effective at all? Because I'll tell you from the European perspective, very highly regulated, and I think only given under as part of a double-blinded randomized placebo trial in tertiary hospitals. That was what happened here. But in India, it is used quite a lot. Do you have any knowledge of what is the evidence base for using it?
So, I've personally used remdesivir many times on my patients, and uh, the studies have not been very favorable in favor of remdesivir. And when I say not very favorable, I mean it has not shown to change the outcome in those patients, in any of the patients. But what it has shown is some patients, a set of patients, and we right now don't know exactly what subset of that patient might be exactly, but a subset of patients has a shorter duration of sickness in the hospital, shorter length of stay in the hospital. So they get better, maybe a day earlier than normal. That is the kind of evidence which we are seeing right now. So, on a population health basis, we probably have to see where should we put our resources more. Should we put our resources more in oxygen steroids, which we know will change the outcome for sure, or should we put our resources in remdesivir, which might uh, get the patient out of the hospital one day earlier than otherwise?
Hmm.
Uh, I, I I would not discourage the use of it as long as it is available. I would. I mean, it is very sad that it is in black market at times in India, but in the US, we still have guidelines where we use remdesivir. It is much more lenient as compared to what the studies have shown. In fact, the recommendation is up to 7 days of symptom onset, we can still use it, but we go up to even 10 days at times, sometimes even more than that if the patient is immunocompromised or a few other comorbidities. But that is because the availability of remdesivir is more, and we can do that. And we don't have to compromise on the resources. In India, if we have to pick and choose between different resources, remdesivir will be lower on my list as compared to many other things.
Absolutely, because on a population level, you have to triage these things, and that's the only way it's going to work. Oxygen is the mainstay of treatment and management, isn't it? Because it is primarily a lung disease, and the lung is starved of oxygen because of what happens with the virus. So if the whole emphasis, from a government and everybody else goes on oxygen, I think that will be life saving. Dr. Rana, do you agree
Yeah.
on?
Yeah, I totally agree. And there are a few other things which are going in treatment-wise, which we are doing in India, which doctors are doing. Ivermectin is another thing. Well, we know that it does not have too much evidence, but I know even the ICMR guidelines, AIMS guidelines have said that you can use it. Again, the thing is, uh, in medicine, we don't know about everything right now. There is a possibility in future that we might say that, oh, a very small subset of patients ivermectin might have benefited. But so far, there's no evidence that ivermectin has benefited any subset of patient in a large randomized control trial. Um, or the double-blinded trial. Now, the other things which I was looking at was there are some antivirals, favipiravir. I don't think we have it in the US. That is used as well. I think there was one study which showed that it does decrease the viral load in the patient. Now, we just think that maybe because the viral load goes down, it can improve the outcome as well. But again, we are not sure. We don't know if it changes the outcome or not. In fact, I can give you one logic why it might not work, and that is because it is not the virus which causes the disease. It is basically the cytokine storm which makes the disease worse. So maybe if we use this medicine, the antiviral, early enough in the disease to stop the viral replication, that might work. But I don't think it is going to work in patients who have severe disease because it's not the viral load which is causing the problem. But
Yes.
again, we don't have any studies on that yet.
That is the problem. It's such a new illness, and evidence is only now coming forward. And in panic, I think everybody tries to take whatever, that's human tendency, is to take whatever medicine you can get hold to. But I think three things, like you said, steroids, oxygen, to mainstay. Yeah. and paracetamol. I think that the cheapest and the most important in early stages of illness is just paracetamol, isn't it?
Yes. And a few other things like if you have the symptoms, if you have cough symptoms and other respiratory symptoms, deep
Yes.
breathing exercises will work. If you can get hold of an incentive spirometer, which can help you with deep breathing exercises, that will help. What that does is that it mobilizes the mucus which is in there, because the mucus itself causes more problems as well. So that will help. Sometimes even prone positioning, laying on your belly is going to help your oxygenation as well. So if you can do that, I would encourage you to do that as well. Some people are using steam inhalation as well. That can help as a mucolytic as well. It can sort of break the mucus down. So symptomatically, if you're feeling good with it, yes, you should do it as well. But then again, I want to say one thing about steam inhalation, that is one of the ways where you can actually nebulize particles if you're inhaling the steam. So make sure that if you have COVID, you are in a separate, isolated room taking that steam. Don't have others be in that room as well. And that whole room will have droplets of COVID at that time. So be very careful if you're taking steam inhalation.
Absolutely. On that
One
point,
question
I just was reminded of a video I saw yesterday.
me
There was
too.
some kind of a hookah bar kind of a situation where people were, in queue and taking. So I was thinking this is a disaster, because even if one person in that group of patients has COVID, it's going to spread to everybody because it will go
Yeah,
in.
I saw that too. I mean, the concept was very good. The concept was in good faith to help people as well.
Yes,
But
yes,
unfortunately, it can end up spreading the disease.
But there was
yes.
one more video that was being circulated on Twitter, which said that you could use nebulizers.
So, nebulizers with the medication is going to help people breathe.
Yeah,
I
yeah, but
agree.
not
But
without.
I saw a video where somebody said that it is going to help your oxygen levels. No, that
Yeah,
is not true. Nebulizer, all it does is that it sort of nebulizes anything which is inside that bucket and
yes.
puts it in your mouth and through there in your lungs if you breathe it in. But it is not going to increase the amount of oxygen which is there.
Thank you. We've
Yes.
been watching so much and seeing so much around WhatsApp shares and Twitter and Facebook that sometimes, even if we know this is not real, this is not right, you still want to kind of question it. And of course, when it comes from a doctor, I'm very bad with Googling stuff. I don't rely on those machines too much. I prefer one-on-one talk, clarifying any doubts that I have. So the questions that I ask, they sound stupid, but I think most of us as laymen, we usually think like that. What if, what if, what if? And when you have somebody, you have a doctor to address those silly, stupid questions, I think I feel more reassured than going and checking on Google. Okay, what is there are so many, helplines available where you could ask those questions. But I think coming from, it sounds more reassuring. And yes, what I'm thinking is right. So that was the purpose I asked you. The nebulizers and all these things are
Yes.
floating around, and we have to be very careful with what we are going to, try at the risk of getting more sick
Yes.
than we
So
already.
Yes.
absolutely, you're right, Nijaji. That is the point of having these webinars every day, because questions are never ending. A lot of people say, "Oh, there's so much overload of information on the internet," but that's why it is overload, and you have to, make it patient specific, because every people have different symptoms, and every patient can have a different trajectory of the illness. That's the problem with this. Some people recover in a day, some people are asymptomatic, and some people end up in ICUs and ventilators, or even worse. So thank you, Dr. Rana. It was really nice to have you. We are coming to the end of today's webinar. You spared your time yesterday and today as well. We are really grateful, but that is your duty, I guess, as a member of the community and a very well reputed doctor in the US. So thank you, Dr. Rana, and we will continue with tomorrow as well. We are having this as a series of webinars, and if the audience has any more questions tomorrow, because there's so many aspects to cover. I just remembered about BiPAP machines and CPAPs and nebulizers, and how best to put them to use when you can't access, or while you're waiting to access oxygen cylinders. These are very simple devices, and spirometers, which you can use at home. So we will continue with this tomorrow at the same time.
But
Namaskar.
if
Thank you
anybody,
everyone for joining. Yes,
but if
Nirja.
anybody has a question that they want
Yes.
to ask now, they can put it on our Facebook live stream, and we'll try and answer as much as we can. Not me, I'm not a doctor, but I have
Okay.
Shafali with me, or
And I haven't seen that live stream, so I can go over there. Maybe if
yeah,
there are any
yeah.
questions, I can try to answer those.
Thank
Sure.
you so much, Vimarji. It was such pleasure, listening to you and taking guidance from you. And to our viewers, we thank them for watching, staying with us, asking questions, engaging. That's what we want. That's how we can help from here. Sari Ruzu, Safe Ruzu, Panun Khayal Theyu. To all those who have lost their loved ones, we offer our deepest condolences. But we have to stay strong. We have to help each other. And thank you to all the volunteer teams that are working tirelessly day in and day out. I think they are doing a phenomenal job, and we're all working together. That's the best we can do as a community. That's a great thing to do, and that's our humble prayers for everybody. Sari Ruzu, Khosh Sari Ruzu, safe Sari Ruzu, healthy. Take care of yourself, please.
Thank
Namaskar.
you. Thank you, Nicha ji. Thank you,